Dr. Ismaniza here. In this topic, I will emphasize on the dose-response relationship. It is important to master this basic concept before you venture further into other topics in occupational hygiene. When exposed to hazardous substances, the toxic effects can range from mild, temporary skin irritation to permanent disability or even death. This shows that dose plays an important role apart from the nature of potential hazard or individual susceptibility. For a given body size, the larger dose produces a greater effect. Just imagine yourself taking 2 tablets of aspirin instead of 1 when having a headache. Meanwhile, for a given exposure, the smaller body size receives a greater effect than a larger body size. One example for easy understanding is the effects of inhaling the same amount of cigarette smoke by an adult as compared to an infant. Do you get the idea? Well, the dose-response relationship refers to the relationship between the dose of a chemical and the response it elicits. Typically, the higher the dose, the greater the severity is expected. Take the exposure of toxic gases in Pasir Gudang incident as an example. Some of the cleanup workers experienced temporary headache, vomiting, and some even had breathing difficulties and collapsed. Nevertheless, there will be a dose below where no response is detectable, known as the threshold, or also known as the No Observable Adverse Effect Level, NOAEL. As the highest data point at which no adverse effect was observed, it is important to establish occupational exposure limits. Have you heard of LD50 or LC50? You may have, but can you tell the difference? Both are used to indicate the relative toxicities of chemicals, with a dose causing death in 50% of the test population. However, the lethal dose, or LD50, is for oral or dermal routes. LC50, on the other hand, is for the concentration of a chemical in the air that is only applicable to the inhalation route. Whether or not there are occupational exposure limits, principle-wise, exposure of workers to hazards should be kept as low as reasonably practicable or allowed. If there is no permissible exposure limit, it does not mean that it is safe, but this is where the allowed principle applies. What I mean here is reducing the intensity, duration, or frequency of the exposure where possible. Nonetheless, it should also take into account the availability of technology, cost involved, severity of hazards, and other limitations. For easy understanding, perhaps you can imagine a worker who had been exposed to wood dust in a furniture making factory. Although the released dust does not exceed the permissible exposure limit of 5 mg per meter cube, exposure can be further reduced by the use of a local exhaust ventilation to capture the dust released. Using affordable face masks should also be encouraged to further minimize the risk. Allowed principles are particularly important to further reduce workplace exposure during emergencies and also for short-term exposures. That's all for now. Thank you and happy studying!